Have you ever talked to your legislator before? This is what we're talking about today. Alice and Serena are bringing you a conversation about what it is to be an advocate. And this week of all weeks, we are so excited because it's our first virtual advocacy day ever.
Yeah.
Serena, do you remember the first time that you participated in advocacy day?
The first time I was a complete and total newbie because, and the only reason I went was because it was the first year ASRM did a course.
Oh, yeah.
It taught us how to be advocates. And this is what I realized about physicians is that I think it's hard to get physicians involved in advocacy because physicians like to be trained before they jump into things. We like to be the smartest person in the room and to be in control. And
that's so honest.
Yeah. So so that made a big difference for me because I didn't want to go in and just be like, not know anything. So knowing that ASRM was going to actually train me to do advocacy made all the difference for me. And it was great because I got to meet a lot of great people and it was amazing. And then I was addicted after that.
Well, that's the thing that happens, right? I mean, the first time, everybody remembers their first time. And then I feel like once you do it once, at least for me, I couldn't walk away from it. It's something because you really and truly realize your voice does matter. It does count. And it sounds cliched when you're in high school government class or political science, courses in college, they show you the one vote makes a difference. But really and truly, when you get involved in the legislative process, you have people who are truly listening to you.
Yeah, it's you're right. That's been incredible. And it's one of my favorite things to do all year long. And you also meet people from all over the country who all have similar interests and similar goals. And you learn so much about not just about the thing you're advocating for, but all the other aspects of it. Like, of course, the doctor part, but I don't know a lot of the other parts. And the legislative process is quite interesting and a little bit odd. So that's been fascinating. And, but so much work goes into advocacy day. And most of it is, I think, really volunteer work.
It is. In fact, Brooke Kingston, thanks for piping in. She loves Advocacy Day. It's the most empowering thing she's ever been a part of. And likewise, it's so empowering. And she chaired, a couple years in a row, Advocacy Day. And it's mostly volunteer run, which I think is also so extraordinary. And, this year heading into it is the first year, because it's virtual this year, that we've ever had all 50 states represented.
Oh, did we get Wyoming? Did somebody come in?
We got somebody, apparently, because I saw the numbers and it looks like we got Wyoming.
Wow.
So, I mean,
see, that's a pandemic silver lining.
It is. It absolutely is a silver lining that we haven't had this before, where we've been able to have everybody represented, because in the past, people have to get on an airplane to go. It's pretty expensive. You have to, DC hotel room rates are not cheap.
Right. And obviously DC is not close for a lot of people. And DC is, can be kind of pricey. The hotels are all
exactly
down there. So, oh my God, that's amazing.
I know. I'm so excited. So virtual, this is the first time we've done virtual, and all the folks who are organizing it, all the state captains and Prime Advocacy, which is the organization that works with Resolve, has done such a great job in how organized they are. We have our schedules heading into the day. Now the day of, sometimes schedules change. And I wanted to give people a little kind of sneak peek of what it's like actually when you are booked for these meetings. So Serena, when you are booked for your state legislature, or, go in, have you been in with your state senator before? Is it usually the aide in charge of healthcare or in charge of?
It's usually, so it depends on the legislation. So a lot of times we've been advocating for vets for a while. So a lot of times there'll be a person of Veterans Affairs. Of course, there's a healthcare person. Then sometimes there's like appropriations people, because the money people get involved, especially with the funding for research and things like that. And so it depends. Sometimes you run into the legislator, you'll run into the congressman, or you run into the senator, and that's really awesome. Like there was, I was just sending everybody, our team, the New Jersey team the pictures, and I posted on Instagram the Throwback Thursday of when when Cory Booker and Rosa DeLauro announced the federal Access to Fertility Care Act in 2018, and
that was so exciting when that happened.
Yeah, the staffers got Cory Booker to come up and meet us, and everybody came. And we had this huge crowd of people waiting for him at the top of the steps. He comes up, and he's like so happy. And then I hand him my phone. I'm like, Senator Booker, will you take a selfie? We got this great moment.
It is so exciting.
Yeah, so that was amazing. Rosa DeLauro, I remember that year she met with people, but they also did videos for us. Senator Tammy Duckworth.
Oh, who I think should be president. I just love her so much. I mean, every time she speaks, like chills and tears and crying, and yet she's so funny.
Inspiring. So
inspiring.
She's a badass.
So inspiring. She is. She's an absolute badass.
And so you sometimes you get to meet the big names, but meeting one-on-one with the healthcare staffers is a wonderful experience too, because a lot of times the healthcare staffers understand the little details of what you're talking about, which is really cool. And I remember like my first year, I talked about LGBTQ family building, and one of the staffers, very young staffer, because a lot of these guys are interns and they're in their early 20s. So you have to try to explain these healthcare concepts to them.
That's right.
And what they don't really understand, they really make up for in enthusiasm. And I remember one of the healthcare staffers just really piping up and then just telling us, that he was gay and that he was so excited to meet us. And it was just such a great moment, because as we told everybody our stories and the things we wanted to advocate for, and people told who they were and where they lived and what their story was, you could see it connecting with the staffer.
That's right.
Well, so it starts out as like a presentation where you're all a little bit stiff, but then you really get to know people sometimes. Like
you do
open up. It's amazing.
We had that happen a lot too with older members of Congress that will pipe up and say, I only have grandchildren because of IVF.
Yes, absolutely.
People do. They start kind of opening up and sharing, because so many of our advocates that we advocate alongside of are so open and vulnerable about sharing their story. Yeah. And not every story has the ending that, that everybody wants. And that's part of Advocacy Day. It's part of raising awareness. Yeah. Right. And that has been an extraordinary experience for me too. And I love when I've done state lobbying a lot up in Sacramento here in California, and I would always lobby with the ASRM. She was my mentor always, and she taught me everything I know about advocacy. And I just love like going from it's a hustle, right? So you're like going from meeting to meeting, and, you're knocking on doors, in some cases cold calling, in some cases finding somebody in the hallway. And it's this rush. Yeah. It is such a rush, right? Yeah. And I mean, that's the part that I remember from my very first Advocacy Day, which actually wasn't even fertility related. It was around cancer, right? Breast cancer advocacy. And I'll just never forget it. Goosebumps, right? Chills. And, feeling like, feeling like I was just, on the right side of change and on the right side of just politics and kind of everything.
The other thing is we go and we talk and we talk and we talk, and you make some personal connections and you tell people you're going to follow up, but we've seen real change from this process. So it's not just getting dressed, going to Capitol Hill and walking and talking till you're blue in the face. Things actually do happen. And that's such a phenomenal thing to be able to look back and say, hey, I kind of made a difference.
I helped. Yeah, I helped. Yeah. Right. I love that too. And we are such a passionate group, like the infertility community. It is such a community. We're such a passionate group. Heather was saying that the moment that you were sharing about the Booker DeLauro bill, and that was such an awesome moment. We all cried. Brooke saying it still makes her cry. I mean, I'm even thinking about it.
Rosa DeLauro that year, she had purple hair. And she did tell us that if we could get this to pass, I don't know when, because a lot of times it takes years, she would do her hair orange for us. So I just want everybody to know that, because orange, because that's our color for advocacy.
Yep, every day this week. I mean, that gets me, I'm teared up right now, even thinking about it. And I think that is an important part of advocacy for everybody to know, is that it can take years. You know, there are certain changes that we tried to accelerate in California that took 10 years. You know, some bills take that long to get through. The surrogacy legislation in New York, I mean, so many years. And I think that is such a key component to advocacy, is that, you know, it's consistency.
It passed. It passed. So many years, so much work, but it passed. It's really going to make a huge difference. And the access law, the infertility coverage mandate in New York, is going to make a difference. It really is going to make a difference.
I know. And I mean, that gives me chills too, because this, you know, advocating means there is a never give upness to advocates, especially grassroots advocacy, the way that we're talking about, where it's a volunteer effort. You know, none of us are paid lobbyists. I mean, not anymore. It used to be.
Oh, we get a lot of support. I mean, that's the thing to know about groups like Resolve, Fertility Within Reach, groups like that.
And even all, you know, EMD Serrano and Faring and, you know, Merck and like all these companies that also get involved, and they support Advocacy Day through sponsorships, and they make it possible for us to do it.
Prime Advocacy is a service that makes a huge difference, and that costs a lot of money. So all that organizational support is really helpful. Right. You need the research. You need to, you go cold, you go with notes, you go with talking points. And, you know, if you have more than one person in your group and they try to pair you up with other people, even if you're the only person from your state, you usually get paired up with other people who are more experienced than you, and they can help you with the talking points, and you split up your talking points and tell your story. And it makes that's really nice too.
It is, you know, and sometimes I just open the door for people.
Yeah.
And like, that's my role that day. And that's okay. Right. Because sometimes, especially if it's a first time, you know, attendee who has a really powerful story to tell, I'd much rather that person tell their story. And sometimes just opening the door, and we're not going to have any door openers. And there's other ways. So for those who don't like public speaking, or are in shy to share kind of in a group setting, they can share on paper, and they can write a letter.
Right. We have to take notes and say, okay, this person on Veteran Affairs said they would talk with this person about this and get them next week, you know, so all those things. And
there's always that, can you email me the fact sheet? Right. There's always, and who's doing that? You know, making sure we all have a role. And right now, you know, we're in the last push for letters. You know, there is a digital way to submit letters. So you too can be an advocate. You don't have to speak. You don't even have to attend, but submitting that letter. We have advocates across the country. This is the collective community. That would show up to advocacy with state letters that was this high, like so high you can't even see it in the camera.
And the fact that you are a voter, that you're a constituent.
Yes.
That means everything to them.
They work for you.
Yeah.
That's the thing that you really realize, is that they take that relationship more seriously than people think.
And a lot,
you know, when they have an actual constituent show up.
Education, right? Because a lot of people don't understand IVF and what are the issues behind IVF.
That's right.
And why IVF is an essential service, and why reproductive health is so important, and how many millions of people these things impact.
That's right.
I remember, you know, and realizing, like, I remember last year somebody telling me they talked to a legislator about a personhood law, and that legislator didn't realize how negatively the personhood law would impact IVF. And they were like, that was an unintended consequence. And that made it, you know, they were like, oh my gosh, I had no idea. And I'm going to go back to the center and let them know.
That's right.
You know,
and that's why we talk about pro-family even, right? For reasons like that. You learn the vocabulary that does connect.
Yeah.
And I think that's powerful vocabulary, because language matters. And, you know, words can be the difference between something passing and not passing, and how it's described. And unintended consequence is another kind of buzzword in our this field of advocacy, right? Because, you know, people go go in with maybe one intention and they have sort of tunnel vision and they don't see those unintended consequences. A ripple effect. Yeah. There is, exactly. Yeah. So I think the last thing I kind of want to wrap up with is a powerful lesson for those that we want to encourage to get involved is that state by state, the way bills become a law varies wildly. So it is really incredibly, I think, cool to get this free education around advocacy, that it's not just federal advocacy that we're talking about. You actually meet with, your state delegation and it teaches you, like, if you want to get a new stop sign put in your street, you will learn how to be able to like make that happen. Or if you have a park that you want to beautify or resources that you want to adopt, like you really do learn how to interact with government at the local and state level.
So people could just go and get on the ASRM site, resolve.org, right. fertilitywithinreach.org, sign up for the newsletter and just check in with them and just see what's going on. Because once you sign up for that, then you'll get little notices like, hey, can you write a letter because this is what's happening in your state. So it's really as simple as something like that.
That's right. So we'll leave it at that. If you're joining us on Wednesday, can't wait to see you. I'm so excited for this first virtual day because I just think it's going to be really incredible to connect with all these folks on Zoom calls and represent for the infertility community and let our voices be heard. So thank you, Serena, for talking about your first time and all the times. And we'll see everybody hopefully on Wednesday for Advocacy Day. And if not, we'll see you next week for another Monday Motivation. Thanks for joining us.